But my family on my wife's side, they're also are blessed. I have one who is, in fact, she's a medical doctor. Uh, she has been dealing with the Ebola epidemic at home and has covered a multiplicity of interviews and write-ups throughout this country and the world. She, in fact, today is known as the Ebola expert, and there are very few. Ladies and gentlemen, let me call on my sister-in-law, Dr. Madea Stone. Let's give her a hand. Come on, Sister Madea.
Afternoon, everybody. I just have to have a sip of water. Well, I have been asked by my brother-in-law here to talk about the state of emergency in Liberia. Now, that's a political statement, but he's also asked me to talk about the Ebola epidemic, and that is what I understand very well. So let's talk about the state of emergency in Liberia. But before I do that, I want to acknowledge my niece, Charlize, for being such a fabulous dancer. She's taking it after me. I would have been a dancer and not a doctor if I was left to my own devices. But anyway, I'm glad that the genes have been passed on to her. Anyway, the president of Liberia declared a state of emergency back in July of this year. And the reason for that declaration of this state of emergency was because for the first time in her presidency, she had to stay in Liberia without traveling anywhere and deal with the issue at hand. And the issue at hand was Ebola. And the reason that the president had to address this and call on a state of emergency is because her very good friend, Dr. Brisbane, had died. Patrick Sawyer left Liberia and went to Nigeria and transmitted Ebola. 2 Americans in Liberia contracted Ebola and had to be airlifted back to the United States. So Liberia then became an international incident. There were all these things happening, and they all happened in 1 week. So the president was forced to pay attention. She had to pay attention because there was no other thing to do but pay attention. And so she declared this national state of emergency, and Ebola took center stage. I had been in Liberia throughout the month of April. I went with a team of people from Mass General Hospital in Boston with whom I work. And we actually went there to do an assessment of the mental health situation in a ghetto called New Crew Town in outlying Monrovia. And when we got to Liberia, there were 5 cases of Ebola in April, 5 cases. The one person had died and died at Firestone Hospital. And other people who were being exposed to her had migrated or had come into Monrovia. And so now you had 5 cases of Ebola. That was in April. In May, everybody was taking it not so seriously because they were saying, oh, Ebola, Ebola, Ebola. Even a senator said, Ebola isn't here. The Ministry of Health is trying to find a way to embezzle more money. There is no Ebola. And then you had the Liberians themselves saying, well, Ebola is just a little thing. You know, I'm walking around because of the lights. Ebola is just a little thing. It's no big thing. People were still hugging. People were still kissing. People were still shaking hands, hanging out in large places. And Ebola took backstage. In June, you had a Ugandan doctor and a nurse at Redemption Hospital, which happens to be in New Crew Town, where we had been in April to do this assessment on the mental health situation of this population of drug-infested young people. So the doctor died from Uganda, who had come from Uganda to work in primary care in Liberia, and the nurse who was assisting him she died. So all of a sudden then, New Crewtown, the focus of attention, which was never the focus of attention to begin with, suddenly became the focus of attention. And then by July, you had escalating cases of Ebola. And when Dr. Brisbane, who was one of the chief physicians, internal medicine specialists, one of the few internal medicine specialists in Liberia, died of Ebola, Patrick Sawyer, who was working with the Ministry of Finance, went to Nigeria after knowing his sister had died of Ebola, denied having been exposed, transmitted Ebola to Nigeria, and Nigeria became an aggressive country that it is and cut out all air traffic between Liberia and Nigeria and made a very serious economic decision because Nigeria supplied most of the air traffic in West Africa. So for them to say, we're not going to Guinea, we're not going to Sierra Leone, we're not going to Liberia, that was a significant portion of their market. But they made that decision anyway, and they got all of their infectious disease experts and their Minister of Health and the President of Nigeria designated $11 million immediately to fight Ebola and make sure that it was not transmitted throughout Nigeria. The reason being, Patrick Sawyer arrived in Lagos, Nigeria, with a population of 21 million people, one city with 21 million people. That is multiple times the population of Liberia. And they were determined not to have an epidemic of Ebola in Lagos, Nigeria. And so with this very aggressive movement, they contained everybody, and today, Nigeria is declared Ebola-free. Now, let me tell you what that means, to be declared Ebola-free. Ebola is incubated for 21 days. But anyone who contracts Ebola can manifest symptoms and become ill within 2 to 8 days. Some people now 2 to 10 days if you're really going to get sick. But the range to be on the side of caution is 21 days because it has happened before. So to be declared Ebola-free, you don't have to pass this 21-day period. They double the cycle. They go another 21 days. And so for a period of 6 weeks, if you have no new cases, then you're free of Ebola, because that incubation phase has passed not once but twice. And that is why Nigeria has been declared Ebola-free. Senegal is also declared Ebola-free because Senegal closed their borders between Guinea and Sierra Leone. Guinea is where the epidemic started. Senegal shares a border with Guinea. There's a lot of migration, a lot of trading between between Guinea and Senegal. They sealed their borders. They were criticized for doing it, but they had no cases of Ebola at all. About 6 weeks ago, a Guinean resident who was a student in Senegal was home in Guinea. Some family member died of Ebola, so he became a contact because he was a primary contact in contact with somebody who had died of Ebola. So the Guinean government, how have they been able, out of 9,000 cases of Ebola, to only have had 1,500 of the 9,000? Because they initiated what is called contact tracing. And they initiated their contact tracing very early on. And what that meant, what they did, was to put their military in the street to make sure people were not migrating here, there, and yonder. And they went from house to house. They kept in contact with every single person who was a contact, whose family member had died, who had had access, who had been to a funeral of a dead Ebola patient. They tracked them down every single day for 21 days. So this young man who was a student in Senegal decides to go back to Senegal to go to school. It is the Guinean government that notified the Senegalese government that one of their contacts had escaped and gone into Senegal. And Senegal immediately came on the alert. They found him, they contained him, and at that point he had come in contact with 70 people. They quarantined every single one of them, kept their borders sealed, intensified the securities at the border. And today, Senegal has had one case, that person who came from Guinea, and it is declared Ebola free. Sierra Leone, on the other hand, shares a border with Liberia on one side and Guinea at another area. So you had the influx of people coming in through these different places. Now, what I need to make clear to you is that when we talk about borders, it's not like your border with Mexico. The borders in West Africa are very porous. And by that I mean you have an immigration checkpoint here, and I can walk over here and cross the street. Because when the colonialists came to Africa and made the division of country, they literally did an arbitrary line between countries that were really one country where families live on both sides of the border. So you divided this country. Families are still living on each side of the border. And today, that situation still exists in West Africa, where you will have complete families living on the Guinean side, complete families living on the Liberian side, complete families living on the Sierra Leonean side, and they are all first-degree relatives. Hence, how did Ebola get into Liberia? You had a Guinean family on the Guinean side who had first-degree relatives on the Liberia side in Lofa County. Somebody got sick in Guinea, came to the Liberia side to be cared for by her sister. They didn't know what Ebola was at that time. She died in the care of her sister. And they all panicked and decided that they would go to Monrovia, which is the capital of Liberia. So Lofa County happens to be a distance that is driving, if you're driving, it's easily a 9-hour drive on a good road. On a bad road, it could take you 20 hours. And so this woman comes into Liberia, having taken a taxi cab with other people in it, the sister. And on her way to Monrovia, she became ill in the taxi. She vomited in the taxi. There are 5 or 6 other people in the taxi with her. The taxi driver decided to keep her at his home because he could no longer take her into Monrovia. They didn't know anything about Ebola. The publicity, this was in March. So there was not this discussion about Ebola in Liberia. Oh, Ebola is in Guinea. It's not reaching Monrovia. But they did not take into consideration when other people were saying to them, seal your borders with Guinea. Ebola is a deadly disease. The government decided that it was not wise to close the border, and therefore the border continued to be porous. Are you all getting it so far? I'm doing it to give you the history of how Ebola emerged to be what it is in Liberia today. So from this one person who was infected by her Guinean sister, she comes into Monrovia, she gets sick. She has 5 or 6 other people in the taxi with her. She throws up. They're all exposed to her vomitus. That is a source of infection. The taxi driver is compassionate, keeps her in his house because he doesn't want her to travel into Monrovia. It's late at night, and exposes his entire household and community to Ebola, still not knowing she had Ebola or even understanding what Ebola was. In the morning, he takes this woman to a clinic near the airport where Firestone has a massive rubber plantation in Liberia. They recognize that she may have Ebola. They take her to Firestone Hospital, and there she died a day later. So she became the first case of Ebola in Liberia. Now, people thought that perhaps the Ministry of Health would have contained the whole area. Well, it didn't happen. What they did was to take chlorine and Clorox and pamphlets into the community where this woman had died, had spent the night, and teach the people how to clean their houses, how to chlorinate this, that, and the other. This was in March. April, they had 5 cases. Presumably, those people who were in that taxi with that woman who had now come into Monrovia. But still, they didn't believe Ebola was coming to get them. So, nobody was taking it seriously. And in May, they didn't have any new cases reported. The reporting is really something that I don't take seriously, because people were dying, people were getting sick, they weren't being reported, nobody was knowing about it, and so there were no reported cases in the month of May. And until the Ugandan doctor died and the nurse at Redemption Hospital, then it became Ebola has now hit a densely populated ghetto area in Ukru Town, where the sanitation is poor, is deplorable. People live in overcrowded situations, and that is a breeding ground for the transmission of a highly infectious disease. Now, after this happened, at John F. Kennedy Medical Center, named after your president, John F. Kennedy, there was a doctor called Brisbane. He was the head of the division, the Department of Internal Medicine at John F. Kennedy Hospital. A patient arrives. The nurses inform him she's vomiting, she's got diarrhea, she's dehydrated, all of the classic symptoms of fever that is over 104 degrees. She's perspiring profusely. And they call him and he says, "Get away from me. There is no Ebola." And so, according to the people at John F. Kennedy Hospital emergency room, he proceeds to take care of this woman with his bare hands, without gloves. And he puts in an NG tube because she's vomiting blood. And so he wants to put the NG tube as a means of tracking her vomitus. Shortly thereafter, he contracts Ebola. He gets sick. He goes home to his house. And when he was dying, his colleagues felt compassion for their fellow medic, their fellow medical practitioner. So when they bring him to the treatment center, in the heat of their excitement and their passion, they lost sight of the reality of the situation and proceeded to take him out of the vehicle. And therein you had a physician's assistant, Dr. Outland, who is now an Ebola survivor, and Dr. Boba. The 3 of them contracted Ebola from their friend and colleague, Dr. Brisbane. Since that time, in that week, Brisbane died. Patrick Sawyer, whose sister was sick, had Ebola. He took her to the hospital. He told people that she was having a miscarriage. Now, one of the things about Ebola, it is known as a hemorrhagic disease, hemorrhagic fever. And why is it called hemorrhagic fever? Because a classic symptom of Ebola, I'm avoiding the lights in my face, excuse me. A classic symptom of Ebola is a very high, unrelenting fever. You start off with a fever that's low grade, and then it goes as high or above 106 degrees. And people sweat profusely. And every fluid that comes out of your body is infectious. Your sweat is infectious. And when you have Ebola to that degree, you sweat and your perspiration is bloody. You produce blood through the pores of your skin as you're sweating. And therefore, they tell you, do not touch the clothing of anybody who is sweating. Avoid coming into contact of anybody who is sweating. Do not shake hands. Do not hug. Do not kiss, because you don't want to come into proximity to this person who may be perspiring blood, and the blood may be infected with Ebola. I'm giving you the details so you will have a clearer picture than what you may be hearing on the television. So that is one way you get Ebola. The fever, they sweat profusely. Having a fever doesn't necessarily just expose you to contracting Ebola. It is what happens when one has a fever. They sweat. The sweat, this profuse sweating, like you're sweating buckets of water, and other people coming in contact with, that is what is infectious. Okay? So, to make the long story short, Ebola is a hemorrhagic disease. It's a hemorrhagic fever. It's hemorrhagic because you bleed. You can bleed from every orifice. You bleed from your eyes, from your ears. Wherever there's a hole on your body, you can bleed. From your nose, from your mouth, your urine, your vagina, your anus. Anywhere there is a hole, you will bleed when you have Ebola to the advanced degree. However, in Liberia, before, when Ebola started in East Africa, in Central Africa, it was a disease that occurred in rural, forested areas where the population was sparse. People were not migrating to the city. The difference between Ebola in Central Africa in the 1970s and Ebola in West Africa is that people have migrated from the rural area to the urban centers where it is densely populated, and hence with poor sanitary conditions, and hence the transmission has intensified because you have Ebola now in urban populated situations with poor sanitary conditions. And that is the difference between Ebola in Central Africa and Ebola in West Africa. Now, of the 9,000 plus cases of Ebola, Guinea, where it all started, has 1,500 cases as of this week. Liberia has almost 5,000 cases, and they have had over 2,500 deaths from Ebola. So that is why Liberia is known as the epicenter, and the cases are increasing. And the only way that Ebola in Africa, in West Africa, will be stopped is for the Liberians themselves to take charge. It doesn't matter how many troops are there. It doesn't matter how much vaccine you take there. It doesn't matter how much money you send there. They've got to change their behavior of moving from place to place, hiding dead people, burying the dead, in hiding infected people in the houses, and when you are sick, knowingly transferring yourself to somebody else's space. And that is the only way that I'm predicting Ebola will be stopped in Liberia. Thank you.
Wow. Folks, we got some education. The people in Basso will say we got some education. There's some things I learned about Ebola, despite everything I've been hearing on the news and CNN and the radio, that I didn't know of. So let's put our hands together for Dr. Madea Stone.